I'm Josh with Waupaca Community Media, and we're back again for our weekly community update with Ron Sari from the Waupaca School District and Aaron Jensen from the City of Waupaca. And we'll start off with some good news. The school district, when you take all your students and staff, you're still in that category that there are less than 5 positive cases. It sounds like a broken record. We say that week after week, and you're in a really good spot.
Yeah, we are. And today was another one of those determination meetings that we had with our county health official, Jed Wolt, and all the superintendents in our county. There's 7 of us. And yeah, you're right. Officially, we are staying in this AB day schedule for our 7th through 12th graders another 2 weeks, unless, at any time something could happen and we may have to pivot and go remote with that 7th through 12th. But right now we're able to keep the status quo. We're staying healthy.
Now, people watching the news are seeing schools right and left changing to all virtual, whether it's on a more permanent basis or maybe to get through a 2-week period for things to settle down. What do you, and we've talked about all the different precautions Waupaca schools have taken. What would you say is the biggest reason for your success so far for keeping it in control?
Boy, the biggest, that's a good question. I would have to attribute it to our staff, students, and parents in the community. I really am pleased, we all are, the level of fidelity that they're doing with practicing those 3 W's, the wearing of masks, the washing of hands frequently, and the watching the physical distancing. It's not just any one thing, it's a combination of several things. That's one of the biggest, but we've put in this extensive sanitizing and cleaning protocol process, and we're daily fogging with that hydrochlorox. I forget how to pronounce that chemical, but it kills all the viruses and bacteria. And they're doing that throughout all the rooms in our buildings on a regular basis. Some districts didn't do this, but we did. Seating charts for all of our kids. And especially in the lunchroom at the high school, I know our kids don't like it, but what it does is it allows us to be more effective in our contact tracing. And that separation, over 6-foot separation, it's keeping us healthy. I mentioned before the sibling exclusion practice. People say, what's a sibling exclusion practice? Well, if one person in the family household or a sibling is a close contact or has symptoms, they all stay home. And that has really helped keep us COVID-free. Our schools are not a place where you're catching COVID. It's not a place where it's being spread. It's a very safe place to be. We hired an extra nurse this year. We have 3 school nurses in our district. I think we're the only district in our county that has that many. They either have 0 or 1, and it's helped us to be very effective in not only the contact tracing, but also the education and the training of staff, education of staff, and communicating with families. And of course, we started in that A-B day schedule with our 7th through 12th graders at the beginning of the year. We didn't have to, because our chart, our decision framework said, it showed that we could have started with in-person learning, but we took the advice of our health professionals and we kept that distance, kept those contacts low. And I think it's paying a good price for us right now doing it, starting the year that way, because we have such low numbers of positive cases in our district.
So speaking of that grid, after the video last week, I saw a couple comments on Facebook where this was posted, well, the school district isn't even following the grid. If you look at what's going on, technically the school should be remote right now. What's your answer to that comment?
Well, I really appreciate that feedback, and that's a fact. If we just followed that grid, that decision framework solely, we would be in person, or I'm sorry, remote learning with 7th through 12th. But just like we said initially, and it even says on that decision framework, it is a tool, it's guidance. It isn't the only piece of data that we use in making decisions on where we need to be at. We also take into account the feedback from our county health official. We take into account the feedback from our nurse advisor or our doctor advisor that we have. And, we have 3 nurses on staff, and we meet with them and we take their feedback into account. And this morning, when we met with our nurses, it was pretty clear that they felt we should stay in our AD day schedule at the 7th through 12th grades. And part of it is because the practices that we're doing are working, and our numbers of positive COVID cases are very low, especially for the size of our cohort, staff and students, 2,448 people.
Well, Ron, I hope when we talk next week to update the community, we have the same news that you're in that less than 5 category.
We're going to keep our fingers crossed. We're going to keep hoping and praying we can. Keeping in-person learning as much as we can is one of our main tenets, so we're going to keep trying.
As far as COVID goes, the school district status quo, but another organization in our community is making a status change as of this Friday, Aaron, and that's the Waupaca Area Public Library.
Yes, our Waupaca Area Public Library has decided to move back to curbside assistance browsing. So really, you can look at that in a couple different ways. I think the important thing and that our library management team wanted to get across was that really it's just offering a browsing type service in a different capacity, right? They're actually still allowing some people to come in for computer usage and for study room usage. All the services that you could get at the library can still be received, just in a little different manner. And I think that decision was made based off of a lot of really good statistics we've received from ThedaCare, that the library management team and library board received from ThedaCare. And I think it's a good example of where we're at in our community and some things that people should be careful. I think that, I'll tell you, me and my wife had an anniversary, and we traveled a little bit this past weekend, and we did some things and tried to do them safely. And it was funny in different parts of the state, seeing how different areas are treating this whole thing. And the places we went, it was, a lot of precautions in place. Everyone was wearing masks. And it was just one of those things that kind of made people feel comfortable getting back to their normal sense of life. And, one thing that I've seen, and the stuff that the library has shared with me through ThedaCare and through the chat team here in the community, how if we told people that the economy was going to recover faster, would you maybe take a little extra precaution? If we told people that you have less of a chance to spread it to a loved one, are you going to take that little extra precaution? If we told people that kids are going to go back to school faster, or in our case, in Waupaca, are going to be able to stay in school longer, would you take that little extra precaution? I know it's an inconvenience. I get that. It's something we're not used to, but it's a pretty minor inconvenience when you look at those types of things. And if we can have an impact on those things, why not do it? I mean, so anyways, that is a little bit about what the library is doing and how they're just switching services this coming Friday to do things a little safer for the community and for staff. So.
In other news with COVID, the governor just issued a new order this week limiting capacity of indoor places in general to 25%. Can you speak on that a little bit as well, Aaron?
I can, yeah. So it's a long order.
I think 7 pages or something.
7 pages, but I think probably the easiest way to sum it up is that, restaurants, businesses, retail spaces, a number of things outlined on there. Really, it's the order states that you have to operate at 25% of your capacity. It starts on, and I didn't write this down.
On the 8th.
October 8th, and it goes through November 6th, I think, currently, right? And, I've gotten some calls already from businesses. How do we treat that? How do we handle that? For example, a restaurant called, do I need to take out tables? Do I need to do all this? And I think it's just, what in your determination, what is 25% of your capacity? If you had X amount of tables in there before, not that you necessarily have to haul them out, but maybe, you don't use 75% of them right So we're happy to answer any questions. If there are specific questions or questions on how to interpret the order, they can call City Hall at any time. But again, another one of those things that is really put in place to address the time we're in here in all of Northeast Wisconsin.
And then in other news, some non-COVID news, the zoning code rewrite continues, and there's a public hearing coming up for that.
There is. I'm going to go back to COVID right after this, if you don't mind. But the public hearing is still set for October 20th. I think we've talked about that on here at least once or twice. And that is our new zoning code. We've been through a process with Plan Commission throughout the last several months. It's coming forward on the 20th. The way that process looks is public hearing happens. That same night, the first reading of the ordinance happens. And then we might get feedback that says, okay, we want to change this, this, or that, or we want to have further conversation on this, this, or that. And then we take it back, rework it, and then you'd come back for that first reading again and reset the clock. If that doesn't happen, if it kind of rolls through, it'd be first reading on that night, and then the second reading the first meeting in November, which is actually the first Wednesday in November because of elections. And then it could possibly go through after that. I think it's important to note too, this is kind of a two-step process for the zoning code. We are running the comp plan concurrently with this. So within the comp plan, there's a future land use map, and that land use map will have to be matched up kind of in a month or so. And we might have to make tweaks and changes based off of that future land use map to the eventual zoning code. So the majority of it will likely be coming forward soon with some minor tweaks in the future.
Okay.
And then I'm going to head back to the COVID just for a second. So one thing I think, just to give an idea of kind of where we're at here in Northeast Wisconsin, and actually I will say that our last report from Jed and Ron, you know, what's happening at our school district is reflective of this too. Waupaca, within our county, they said Waupaca is doing about as good as anybody in our county right now for cases and stuff, which is awesome. Looking at it more from a regional standpoint, there was an announcement today that the state health department is opening up an alternative care facility at State Fair Park in Milwaukee. That's going to be open for COVID patients only on October 14th. And that is a result of what's happening in our part of the state, not necessarily what's happening in Madison, not what's happening in Milwaukee. It's a result of hospitals being at 95% plus capacity, really from Oshkosh to Rhinelander and from west of Stevens Point to Green Bay. So if you take a look at that part of the state, that's where we're at right now. And we're starting to see those impacts that we talked about not wanting to see in July. So again, just another reason, if you know, to just take that little extra step to make sure that everyone can move forward in a positive way.
Well, Aaron, Ron, appreciate the time this week. We had some good news, maybe some not so good news, but it's good to hear schools are still open and the students are learning. A little disappointing to hear about some changes at the library at this point in time, and maybe some of the capacity limits with healthcare, but you know, at least there was some good and bad to talk about. So thanks again, and we'll talk next week to get our community up to date with everything going on.
Thanks,
Thanks,
Josh.
Josh.